there's very low tech things that we can do. One of them is trying to, within Virtua Medical Group, we have, I believe it's 27 primary care practices at this point. And some of those practices actually do this very well already, where they have a coverage system in place that when a physician goes out on vacation, they have a very structured way that the physicians who remain in the practice are able to cover. And so when that doc goes out, they know, they feel confident that their patients are going to be taken care of. Other practices, traditionally have used a model where, oh, okay, well, when Dr. Smith is away, we'll take care of any emergencies that come up, but we're, things that aren't emergencies, routine lab results that come in, low non-time sensitive patient questions, we're going to let those sit for when the doctor comes back. And then that leads to that anxiety as the doctor when you're away that, oh my gosh, I'm going to come back to an in-basket that's going to be 300, 400, 500 items long. So one low-tech way to address that is to look at the best practices and create a structured kind of coverage system, again, so that when docs go away, they truly can sign off. We've also looked at some more innovative ways to address this, and so one of them is through in-basket management. We have a series of initiatives that we bucket under the term taming the in-basket, and our taming the in-basket initiative is supposed to do just that. It's supposed to take a lot of the messages that come into us on a daily basis, whether we're in the office or we're on vacation, take those messages and really screen them and make sure that they are going to the appropriate staff member. So obviously not every message has to come to the doctor. Many of them can be fulfilled and completed by other staff members in the office. And so we've put a lot of time and effort into making sure that messages go to the appropriate person within the office, and only the things that really need to be seen by a doctor go to the doctor. Another initiative that we are piloting, this is not something we've done widespread, but I think it's very, very innovative, is in primary care, we've hired a couple of what we call in-basketologists. So, just like you have a cardiologist, a gastroenterologist, we have created an in-basketologist. So this is generally it's a nurse practitioner who we hire not to be necessarily seeing patients. They don't have their own schedule, but their role throughout the day is to mine the in-baskets of the other clinicians in the practice, and again, take out everything that doctor does not absolutely need to see and be able to handle it. And this is a nurse practitioner, this is a licensed, trained clinician who is able to answer clinical questions in a way that medical assistants or even registered nurses sometimes cannot. This has really cut down, I mentioned those metrics before, pajama time and something called time outside of scheduled hours. This has been shown to significantly reduce the amount of time that our clinicians spend outside of their scheduled hours. And also we have found, again, anecdotally, it has drastically cut down on that urge for our physicians to check their in-basket while they're away on vacation. So I think that those types of initiatives, that type of innovation is going to be crucial in addressing this problem, because again, as the JAMA article cites, the EMR and specifically the in-basket part of the EMR, where all of our messages come in, is a major driver of burnout amongst physicians. So the better we can address that, the better we're going to address burnout, and hopefully lead to more professionally fulfilled physicians and lead to hopefully longer careers for our physicians as well.